Have you heard about the important part of chiropractic care called critical transition care? Welcome back, Dr. Alan McCord at Kent E's Chiropractic here, where we're continuing our series on talking about what care is right for you. What we're really concerned about here at Kent E's Chiropractic is helping you to decide what type of care plan is going to best fit your needs, because that's what we want to do. And there are different choices of care. We have this poster here we use all the time with our practice members. And by the way, we're a 100-year lifestyle affiliate, so we really help focus on this part of care called lifestyle, which we'll come to. But the lifestyle care continuum is a poster here that shows, it actually talks about the importance of keeping your spine and nerve system healthy for life. And you see here on the right side, we have lifestyle care. And the goal here with lifestyle care is, and you may have heard of people that continue to keep coming in to see a chiropractor. That doesn't mean the chiropractor is really bad, or it doesn't mean they're really sick. It just means they're utilizing chiropractic care for lifestyle, and their focus is optimal health and peak performance. They want to stay healthy into their later years. And we're in the process right now as a profession to really help and educate people about the importance of this. But for a long time, and actually chiropractic this year in 2020 is actually celebrating its 125-year anniversary. And so initially for the first 100 years or so, the focus has been on crisis care. And that's really been the model of our overall healthcare in the United States is we wait till we get sick. It's really not about healthcare, it's really about disease management. And so here on the left, you see the title crisis care. And the goal with that, and we see a lot of crisis care folks who have a complaint that doesn't go away, they're unable to manage it with drugs and their own self-care program, and they just don't get better, and they come in to see us because their goal here is to relieve and stabilize their problem. And so we do really good with that. The problem is that many times symptoms, which can be elicited, and the most common ones we see are neck pain, headaches, back pain, those kinds of things. The symptoms are usually the last to come, but the first to go away. And so a lot of times we are so good at helping to correct these imbalances that their symptoms go away, their bodies manage it in a way, and they heal very quickly. So they can tend to think, well, the symptoms are gone, that means our problems are fixed. Really what's driving that, and we find this all the time in our profession, is a condition called a subluxation that affects the nerve system. Only 10% of the nerve system actually perceives pain or symptoms, is sensory in nature. 90% runs the body. And so many times symptoms are the last to come and they're the first to go away. So what happens then is patients or practice members come under crisis care, they feel better, and if they're never taught and explained this whole process, they stop coming. And the dentists have done a really good job in our culture of educating us about dental hygiene care. And that is, I'll bet you brush at least once a day, maybe even twice. You probably floss your teeth, and you probably go in regularly for 6-month checkups with the orthodontist. All of that is really, really important because that helps keep your teeth healthy. It helps keep you from getting sick teeth, let's say, maybe dental cavities or caries, what they're known as. And so we are accepting of this. In fact, a lot of times our mechanics take care of a car this way, where we come in regularly for 3,500 mile checkups and get a tune-up or get an oil change. All of that is really important to keep ourselves from relapsing or going back into crisis care. And so this point we're talking about here today is critical transition. The reason we call it critical is because what we want to do is help fix the problems, the underlying problems that have caused the symptoms in the first place that you might be experiencing, and help you push through so that you end up moving into a lifestyle care where you keep your body healthy and you don't have to worry about those kinds of complaints that maybe drove you to come in for crisis care anyway. So, and the other point about critical transition is we're constantly under stress. For example, gravity. Our heads weigh about 10 to 12 pounds. Gravity's constantly pushing on our head, pounding it through our spine. Poor posture, new condition or new stress in our world today is what we call tech neck or text neck, where people are looking down all the time at their phones or their cellular devices, their computer systems. You know, and we live in this world where a lot of sitting, we're sedentary, we're not moving around as much. And so all of these stresses compile, let alone things like, for example, work-related injuries, injury at home, sports-related injuries, motor vehicle accidents, all combined and compile and can actually shift or torque the spine out of position, lending itself then to sickness and disease and ill health throughout your lifetime. We want to prevent that. We want to not go back into that type of a situation. We want to help you from not relapsing. We want to help continue into health, forward motion you into thriving with your care. And then also the other good thing about this critical transition portion of our care is we help your body better adapt to life and the stresses of life, so you're not going to be back there. So this is a plan that's usually less frequent than crisis care, and it helps move you into a lifestyle care. It's usually about a once a week type of frequency, moving you into lifestyle care, correcting those underlying problems, and then helping you to thrive and keeping you in optimal health and peak performance. So long video here, long talk, but I hope this has been powerful to really help you to understand the value of coming in when you're not in pain, to keep moving forward, to help your spine and your core heal at its best for optimal health. So I hope you continue to view a lot of our videos on the entire series on what's the best care for you, what's right for you. And thanks again for joining us, Dr. Alan McCord at Kent Chiropractic.